Dr. Flint, you mentioned there's a misinformation campaign going on. Tell us more about that.
Okay, if you think about, as you'd mentioned, the three prongs of health policy: improve access, improve quality, and contain cost. We talked about the misinformation, what people voted against their own interest in terms of improving access to care. One of the biggest myths is that Obamacare allegedly was enacted to contain costs. Well, that was a secondary goal, and it does have cost containment elements in there. For instance, we talked about the first dollar coverage of preventive care. That's something that we know is going to yield benefits, but not today, but it will over time. And if you look at the amount of money that has been spent, if you take a look at healthcare costs, you have to take a look at the aggregate cost. Between 2010 and 2017, that 7-year period, that was the slowest rate of growth of healthcare costs since we've been keeping records in 1960. Okay.
That's right, because my premiums, doctor, they've been skyrocketing.
Well, I understand that, but and the other thing is they say, look at the exchange premiums are skyrocketing, but the individual person isn't necessarily paying that, okay? In other words, if the premium goes up, how much does your employer cover? What kind of a subsidy do you get? How this filters through all of the different financing matters a great deal. So the point is the aggregate cost. Obamacare never promised to reduce prices like telephones and computers and televisions, okay? They're actually, the nominal prices actually decline. What Obamacare was designed to do was to bend the cost curve. In other words, instead of going at a rate like this, it goes at a rate more like this. Because if you slow the rate of cost, that's all you need to get in balance the federal budget on its Medicare side and Medicaid, et cetera, okay? So the Republicans have been saying, well, costs haven't dropped. Of course they haven't dropped. They increased dramatically before Obamacare. They increased moderately under Obamacare, and they're going to increase afterwards as well. We know that costs are going to increase. But when they repeal Obamacare, they're repealing all of the cost containment. For instance, I mentioned the benefits of prevention that we find. In addition to that, quality improvement. If you improve the quality of care, you reduce the cost. It's estimated something like up to 1/3 of healthcare is either redundant, unnecessary, or harmful. And we need to get, and for 30 years they've been trying to figure out what is unnecessary care, superfluous care, and what's absolutely medically necessary, okay? Under the Obamacare, they have these accountable health plans that provide bonuses for improvement of quality. So, in other words, risk prevention, hospital infection control systems are incentivized under the Obamacare plan. Following practice guidelines, making sure that someone discharged from a hospital, psychiatric hospital, is seen by someone in the community 7 days afterwards. Keeping up with diabetics' eye exams and assuring that beta blockers and ACE inhibitors are prescribed after heart attacks. Okay? Point is, if you can reduce hospital readmissions, if you can reduce unnecessary care, you're containing costs. All of that is incentivized through payment systems and a variety of other things under Obamacare. That would be lost. So instead of bending the cost curve, we'd have a reacceleration, okay? So again, with respect to cost containment, you've got quality improvement, which I described. You have leveraging preventive care and early detection of disease, blood pressure screening, et cetera. And the third leg of this three-legged stool is the medical loss ratio. It's a regulation, it's complicated. I don't want to get into the details of it, but here's the bottom line. The medical loss ratio prevents health insurance companies from price gouging on premiums. It requires that 85% of every premium dollar that comes in has to go to actual provision of care or quality improvement. And if there's any money that is in excess of that, in other words, if they spend less than that, they have to give rebates to the people who have coverage. In Pennsylvania, in the first 2 years, got over $19 million in rebates. Some of those came to individuals, some of those came to the employers. It all depends upon who purchased the care.
Purchase the plan.
Purchase the plan, that's right. I mentioned that there was, in 7 years, that's been the cost curve, in fact, has been bent. It is a lower acceleration of cost. One other thing.
That's been misrepresented to the public.
It's been misrepresented because people say it didn't bring costs down. It didn't go below zero. Things aren't cheaper in nominal prices, never mind inflation adjusted.
Worse than that, they've been saying it's a complete disaster, and it's not.
They're saying it's a disaster. But how about the Congressional Budget Office? The CBO twice has redone estimates for the cost of Obamacare. How much is the ACA going to cost? Both of the estimates, one done in 2012, one done in 2014, both estimates reduced the cost. So the fact of the matter is, Obamacare is costing the government less than the CBO projected. And every time they look at it, they see that the cost containment is bending the cost curve. So we have evidence, lower aggregate cost and less cost to the government. So that should put to rest that issue.
And Doctor, isn't it more than that? Aren't the Republicans also trying to deliberately sabotage Obamacare apart from that?
Well, in terms of the issue of private insurer participation in the health insurance markets.
Talk about
the
that.
health insurance exchanges, rather.
Please talk about that.
There are two things that the Trump administration has done. Okay, the first thing is they said that they instructed the IRS to not enforce the individual mandates. So remember, we talked about the crucial piece of Obamacare was to get everybody paying premiums, everybody paying into the insurance pools. And if you don't, you have to pay a fine. The fine is up to $695. Trump said, don't fine people the $695.
How do you know that?
It was in the because it was a federal what is the
a reg?
He changed the reg through an executive order.
Gotcha.
Okay.
Executive order.
So that was done through executive order, where it picks it up and shows everybody. Okay. That's the first thing. The second thing he did is he said that that the way the Obamacare and other laws are written is the Secretary of HHS shall appropriate sums such that are necessary for, and one of those things that they have to is to pay the premiums and the co-insurance for low-income people in the exchanges. That money goes straight to the insurance company. So it's not like somebody on the exchange goes to the doctor and there's a $100 copay for the service. The government doesn't send the $100 to the patient, it sends it to the insurance company. They threaten to not pay them. And this has been done multiple times because they say that the Secretary of HHS will not appropriate such sums that are necessary. So of course insurance are dropping out of the market. Okay? So they're sabotaging it. So here you have a situation where you have like the kid who killed his parents and goes to the judge and says, "Have mercy on me because I'm an orphan." The Republicans have done the same thing. They're killing the health insurance exchanges. They're driving the insurers out and saying, "See, Obamacare is driving them out." No, it's the perversion of Obamacare that's driving them out. And there are solutions to that as well.
What are the solutions?
Well, for instance, we have Medicare Part C. We have health insurers in every single state making insurance available to Medicare insurers, which is a vulnerable population. Every state except Alaska. Why don't we just use those people?
Doctor, we've had the Republican.
Okay. The thing about the Republican health care bills that is not as well known as it should be is it goes well beyond repealing Obamacare. It also is a frontal assault on the Medicaid program. But let's do one at a time. Let's talk about Obamacare. If you didn't have Obamacare, you will be affected. Remember we talked about the different categories of insured. lifetime and annual dollar caps on how much you have to, how much an insurance company will pay to cover your care, those will be gone. First dollar coverage for preventive care and healthcare screenings, that will be gone. Preventive care coverage for Medicare beneficiaries, that will be gone. The 8 years of the extending of the life of the Medicare Trust Fund because of the Obamacare taxes, that will be gone. So now Medicare becomes financially at risk again. The Medicare prescription so-called donut hole, which has saved people in Pennsylvania $1.3 billion in drug costs, that would be gone. And the one that has gotten the most discussion is the being able to get insurance with pre-existing conditions. Under Obamacare, because everybody was in, we had the funds for pre-existing conditions. Now, the CBO estimates that 22 million people are going to be taken out of Obamacare. They will, excuse me, if the law is passed, 22 million people will lose health insurance coverage. In addition to the people who would get weaker health insurance or might not be able to get health insurance because pre-existing condition exclusions are gone. What they've said instead is we're going to have backup money, but we've had high-risk pools. They have failed. That's why Obamacare has, has made these changes. So the quality of coverage is gone. The cost containment that Obamacare brings to the table would be gone. And 22 million people will not have coverage.
Dr. Flint, I'm confused. The Republicans are doing this because they are trying to fulfill promises to the people on this chart right here who this is to benefit, but yet it's hurting them, I understand?
Yeah, it's a betrayal of the Trump voters. It's a betrayal of the Republicans. You saw in the maps, these programs are more beneficial to the communities where there is a higher proportion of Trump voters than Hillary votes.
When you say these programs, you mean Obamacare itself?
That's correct. The components of Obamacare, especially the Medicaid expansion, okay? And people are going to die. You know, people are going to die.
All right, let's talk about that, Doc. People are going to die. Do people really die without insurance?
Absolutely. The evidence is overwhelming. The Institute of Medicine, which is part of the National Academy of Sciences, did a study a few years ago that showed lack of health insurance among adults aged 25 to 64 directly led to 18,000 unnecessary deaths in a year. It's the 6th leading cause of death. 18,000 people. That means every 2 months we have one World Trade Center's worth of death. You know, 3,000 people died on 9/11. 6 times as many people die every year because of lack of health insurance. That's the Institute of Medicine. This isn't a left-wing, argument. Another study in the New England Journal of Medicine, 10-year study. They took 3 states, Maine, New Mexico, and New York, that expanded Medicaid to cover the same population that the ACA, that Obamacare would cover. After 10 years, they found that the death rates in those 3 states were 6.1% lower among the adult population than 3 adjacent states that didn't have it, that didn't have the same eligibility for Medicaid. There is no question. The evidence is, there's more evidence of this than there is of climate change in terms of unanimity among the scientists who study this.
Dr. Flint, the 3 Republican health reform bills all wanted to repeal Obamacare. What else did they want to do?
Well, I think that's a little known piece of this supposed Republican health reform. The health reform bill attacked Medicaid. It didn't just take away phase out the Medicaid expansions under the ACA. It is changing the fundamental nature of the entitlement of Medicaid if it were enacted, okay? So what are they trying to do? Under current law, states have their state plan where they have eligibility and benefits, et cetera, and like I say, for every dollar they pay, the feds give them anywhere from another $1 to $2 back to cover the cost, no matter how much the cost is. Under this plan, they have something what's called a per capita cap. Now, what that means is if the average cost, the average expenditure under Medicaid is, say, for round figures, and it's less than this, but let's just call round figures $10,000. They say, okay, fine, we're going to give you $9,500 per person. So they drop the average amount, and we're only going to increase this amount per capita by the rate of inflation, not the medical care component, the rate of inflation. And that, by the way, that nuance was added by Pennsylvania Senator Toomey. He was the one who said, let's not increase the cap. So the per capita cap is gone. So now it's no longer an entitlement program. Now there is no longer federal share based upon state spending. All these things now become state expenses. And one other thing it did too, it takes away Planned Parenthood as a legitimate provider of Medicaid health care services, even though they already had taken out money spent on abortion, which is like 3% of Planned Parenthood's budget. Now they're saying the other, the mammograms, the prevention counseling, all of that is gone. So so they attack one of the main providers of care for women by defunding them, and they take away the entitlement status by this per capita cap approach that will, as a result of which, over the next 10 years, there will be anywhere, depending upon the bill, $773 billion to $820 billion less money spent on Medicaid beneficiaries. And again, remember, this is nursing home people. These are people on Medicare too poor to pay for their drug coverage and their eye exams. These are low-income kids. $800 billion over the next 10 years will be gouged from that budget.
Where do you think we're going now that repeal and replace hasn't worked?
I suspect that the cuts in Medicaid are going to come up when they discuss the budget and when they cut tax reform. And again, if you look at the three biggest entitlements that account for 2/3 of the federal budget is Social Security, Medicare, and Medicaid. They are not going to touch Social Security and Medicare. All the cuts are going to come from the poor. They will attack the weakest client, not the weakest case. And I suspect that what they were unable to do under health reform, they're going to now try to do and call it budget reform. So the attack on Medicaid, I'm sure, is going to continue, not only stripping away the progress made since 2010, but all the other progress made since the early 1980s when Medicaid began its expansions.
You told us about Obamacare cost containment. Don't the Republican health care bills have any cost containment in theirs?
Right. Well, the Republicans claim cost containment, but it all boils down to cost shifting. There is absolutely no real cost containment in the bill. If you want to contain costs, like I said, you improve quality, you make health care less, treatment care less necessary because you substitute preventive care. You can do other things, provider fees. So there's no funding for it, and Republicans put in the law that the federal government was not allowed to negotiate with pharmaceutical companies. So that still remains. Why can't we negotiate like the VA does and France and Germany and every other country? Why is there no provider fee cost containment? Or provider fee price negotiations. Why isn't that in there? They talk about people are going to be able, the third health reform bill, the second Senate bill, had the Ted Cruz, we are going to waive essential benefits. So as long as insurance company offers the full Obamacare benefit package, they can offer a skimpier package, a bare bones package. No preventive care, no emergency care, limits in the amount, duration, and scope of benefits, etc. And they're going to get a lower premium. Well, that's not reducing cost. They say you'll be covered for less and you'll have a lower premium. But what happens when you need those services? What happens at that point? So the fact is, it's all cost shifting. They're taking money out of one place. They're trying to reduce money to consumers, to premium payers by giving them less care, by giving them less coverage. It's a cost shift, not cost containment. The aggregate costs are going to keep going up. The bend in the cost curve is going to start reaccelerating again. It's just that it comes out of different people's pockets. Another aspect of the cost shifting is lower premiums for younger people and healthier people, and higher premiums for older people and sicker people. Under Obamacare, the youngest, healthiest person would be charged X, and the most a 64-year-old sick person could be charged is 3X. That's changed. So instead of tripling the lowest cost, now you can pay 5 times as much. So yes, it's true, a young, healthy person with the same benefits will have less coverage, but an older, sicker person is going to have massively amounts of much greater cost and premiums. And who needs the coverage? The older, sicker people are going to pay more for premiums, and they're probably going to have less benefits because the essential benefits will be gone as well. So again, nobody is saving any money. Well, yeah, when you rob Peter to pay Paul, Paul doesn't mind. Except in this case, we're robbing the old and the sick, and we're paying the young and the healthy. Is that good public policy?
We as a society aren't better off. Our most vulnerable are going to be much.
Costs are shifted from the young and healthy to the old and sick. It's just that simple. They're not being contained. There's not a reduction in cost. It's just old sick people are going to pay a heck of a lot more. And then there's the people with pre-existing conditions who knows what their premiums are going to be. They're not going to get the community rating anymore.
Are they going to be dropped? Are they going to still say that are they going to be covered?
We don't know. We don't know how it was going to be worked out. But again, fortunately, we don't have to worry about it because the bill's dead, at least at this point.
How was Obamacare funded?
Okay, Obamacare was fully paid for. It didn't add any money to the budget deficit. In fact, it actually reduced the budget deficit and increased the length of the Medicare Trust Fund. It was paid for by a variety of taxes. For employers who didn't have the employer mandate, had to pay $2,000 per employee who's not covered. Some individuals who didn't take health insurance, even though they were required, would have to pay taxes. There were taxes on tanning salons, taxes on medical device makers. So there was that whole array of taxes. But the biggest chunk came from taxes for individuals earning more than $200,000 a year and families earning more than $250,000 a year. All of those taxes for the rich were all eliminated under the House bill and under the first round of the Senate bill. Now, for the second Senate bill, the Republican House, all of those taxes were eliminated under the Republican House bill and under the first version of the Republican Senate bill. The second version of the Senate bill, because of the criticism that they were throwing 20 million people off insurance to give tax breaks to the rich, doesn't have those maintains the taxes for the rich. But it was with a wink and a nod, knowing that tax reform is the next bill, so they're going to be able to take care of those folks at that time.
Now we can expect with tax reform that they're going to that the Republican administration will attempt to undo those Obamacare taxes.
Given their legislative history, given what they have said, what's in their platform, and what they have done at the state level, I think what we should expect to find is reductions in Medicaid, which will hurt the poor, reductions in income taxes, which will help the rich, and there'll be some other scatter. But the big chunks is going to be an attack on Medicaid and restoration of the Obamacare taxes. Don't know the future, but given everything they've said and everything they've done, it all points in that direction.
So, Dr. Flint, is what you're saying is that they still will attempt to throw people off Medicare. They just won't call it a health care bill. Is that what you're suggesting?
That's in President Trump's initial budget, were Medicaid cuts that went beyond the cuts in the health reform bills. So they've already said they're going to cut back Medicaid beyond the $800 billion. The budget bill actually came in for a second bite under the assumption that the $800 billion over 10 years was already taken away. So we know what they're going to do. They've told us. It's in print.
So this is an ongoing fight that probably will never end.
This is a fight to establish the notion of health care as a right. We're the richest country in the world, yet we don't have universal coverage. The only country, the only industrialized country.
Doctor, why should you and I, who earn a living and probably are insured, not on Medicaid, care if all these people are thrown off Medicaid or not? How does it affect us?
Putting the ethical issues aside, Medicaid affects us because we have a healthier citizenry, a healthier workforce. We have hospital services. 49% of all births in the United States are paid for by Medicaid. Half the births. More than half of the patients in the neonatal intensive care units are Medicaid patients because they have a higher rate of low birth weight babies and other babies that have problems. If we don't pay for those neonatal intensive care units through Medicaid, then they're not going to be available to anybody in the community, no matter how much money you have. So if you burn units, expensive imaging, these are services that hospitals provide because they can afford, they provide it to everyone, rich or poor, because they have a payer mix, a patient mix where they're getting paid. If they don't get paid, then they cannot afford high-cost services. So you're driving down the highway and you get in a car accident and you need a level 3 trauma care. Good luck without a Medicaid program in your state, because you're not going to have that. We know there's evidence, there's research evidence that states that have tinier Medicaid programs and reimburse less under Medicaid have fewer services available to the entire public. So again, in addition to the stimulus of Medicaid funds going into the economy for, through better employment, et cetera, for people that work at safety net hospitals, federally qualified health centers, the biggest at-risk institutions are rural hospitals. Those are the ones that really would fold without Medicaid. There's just no question you'd have a loss of access to care. And again, not just for the poor, but for everybody who lives here. We're all in the same boat. We all are Medicaid beneficiaries in one way or another.
And we all need each other.
We all need the Medicaid money.
So this is an instance of being maybe penny wise and pound foolish with cutting the benefits to the poor.
That, I think the weight of the evidence is overwhelming that that's the case.
Well, that's all we have time for today. Doc, I want to again thank you for appearing on my show.
My pleasure. My pleasure.
This is Larry DeMarco. We were here with Dr. Sam Flint. This is Delaware County Political News. Please tune in for next time. Bye for now.